good to go. Very good afternoon, sir, and we welcome you here. I'm really sorry there are technical glitches this time, but we'll try our best to maintain this. You can start the session, sir.
Yeah, very good afternoon, all. Yeah, first of all, I'd like to thank Sphere India for giving me this opportunity to share some knowledge with the audience here today. This talk is basically directed towards the so-called uh, social mobilizers. That means to say, like the people who can reach out to the community and educate the people about the importance of getting this vaccine. So, like, yeah, obviously, all other like everyone can join this, and everyone is welcome to ask questions. I will be delivering this talk in English, although I'll be welcoming questions in English, Hindi, or Manipuri. So, so today, like the topic is COVID-19 management and the vaccination. So we'll be talking about the role of vaccination in the management of COVID-19 pandemic as such. So this is more towards the health, healthcare workers. So we all know the case management protocol for a patient who is diagnosed as a case of COVID-19. But when we talk about vaccine, here we are looking at the larger picture. So, what is the role of COVID-19 vaccine in the larger picture? For example, when I get the vaccine, so what is the benefit that I get from this? So, first thing is that I'll be ensuring my own safety and the safety of my family members from the virus. Number one. Number two is we're helping in increasing the herd immunity. So, what is herd immunity? We'll be uh, getting to know about this with a short clip that will follow this slide. And obviously, because of that herd immunity, it is going to help in curbing the pandemic. And obviously, it will help in avoiding the second wave of virus that we have been talking about for quite some time now. So this is a short clip.
What is herd immunity? Picture a community or herd of healthy people. An infectious disease would pass easily through the community from person to person. Vaccines train our immune system to protect us from diseases it hasn't come into contact with before. For example, the MMR vaccine provides immunity against measles, mumps, and rubella. During an outbreak of a disease, vaccinated people will remain healthy. As they won't become infected, they won't pass the disease on. When most of the community is vaccinated, it makes it difficult for the disease to spread within the community. This is called herd immunity. If more people within the community remain unvaccinated, herd immunity can break down, allowing the disease to spread more easily. Herd immunity is especially important for individuals in the community who can't be vaccinated. For example, if they're too old, too young, or have weak immune systems.
So this is the importance of herd immunity. That is the main strategy that we are focusing when we talk about vaccination of people. So as social mobilizers, we have the responsibility of disseminating the correct information regarding the COVID vaccine and obviously about regarding the pandemic and the entire process of rolling out the vaccine and obviously in dispelling the various misinformation that is surrounding the vaccines. So what are the peculiar facts about the virus? One thing is that it's a new virus. We all know it started in Wuhan in China in December 2019. And what is another striking feature? It is very prone to get frequent mutations, just like the influenza. And it's a fatal disease if timely intervention is not uh, done. And obviously, we all are aware of the long COVID, all the post-COVID sequelae. However, the positive side is that we can curtail this disease with proper safety precautions and the risk management. And we all know that the economic impact can be huge. And through proper precautions, we can take care of the fatalities as well. So, what is this Swiss cheese model for respiratory virus pandemic defense? So, we are like, okay, some of us are aware of the comic series, that's the Mickey Mouse. Like this cheese is the one that is a favorite of Jerry basically. So this is what is called the Swiss cheese. The thing is that it has multiple irregular holes married in it. So if you look at it, on the one side we have the virus, and on the other side we have the person. So in between there are many barriers that we can establish. In fact, for the virus not to reach the person, not to reach the uh, yeah, individual and infect him. So what are they? So we have this, the physical distancing, proper ventilation of our living space, and mask, hand hygiene. Now we are very much aware of it, and obviously fast and the sensitive testing and the tracing, and the quarantine and isolation measures, and government measures to distribute uh, proper education material, and obviously vaccine that we have that is the topic of today's talk. So we should rather be safe than sorry. So we all know these various methods of hand hygiene. uh, okay, this is not very important per se. So we have many ways of manufacturing a vaccine. So we have this vector vaccine, DNA, RNA, antigen, and vaccines based on antigen presenting cells. And we have whole inactivated virus, live attenuated virus, protein subunits, virus-like particles. But this will not be very important for all of us. These will be important for the people who are closely associated with delivering healthcare. So we'll skip going into too much detail about these ones. So basically, we have so many candidate vaccines right now that is available all over the world. However, we'll be concentrating our talk only on two vaccines, that is the Covishield and the Covaxin. They are authorized for distribution through the government agencies as of now. We all know Covishield is a virus vector vaccine and Covaxin is a kill virus. Why is it important? Yeah, we'll be talking about the importance of knowing the nature of these vaccines when we talk about the side effects and all. So, what are the uh, what are the sites for vaccination? This obviously the government institutes like medical colleges, district hospitals, community health centers, primary health centers, and then we have large private hospitals that have been incorporated in the second phase. And in the future, many more other centers are planning to be recruited. Talking about Manipur as such, we have these empaneled private hospitals where vaccination will be available. We have altogether about 9 hospitals, including one in Chorasanpur and another in Kaching district, and others are in Imphal district only. So, talking about the eligibility for the vaccine, in the first phase, people who were eligible were the doctors, nurses, and technicians, and other employees related to hospitals like ambulance drivers, cleaners workers, and all frontline workers like the okay. And but from the second phase onwards, actually we have included all citizens above 50 and citizens between above the age of 45 with comorbid conditions, that is coexisting diseases. So what is the process to get the vaccine? So we all have to educate the people about the process to get the vaccine. So we have everyone has a smartphone nowadays. So we have to ask them to go to the Google Play Store and download this app, and we have to explain them the process to get registered for the vaccine and to get a vaccine. So the person has to get the registration done, and his credentials will be verified, and then he will be told about the date of vaccination. He will get SMS reminders on his phone, and after that, uh, he is supposed to get certificate for both the first dose and the second dose of vaccination, and he will be and then he is supposed to report any kind of adverse effects that he has either during the observation period at the hospital or uh, in the subsequent period. So the message is that COVID-19 vaccine is safe, although we had some initial doubts about Covaxin. So the recent report published by ICMR clearly says that it is safe and very effective. So what talking about the COVID vaccination center, actually we have to roughly familiarize the patients with the center. Uh, there will be 3 rooms. There will be facilities for hand wash and sanitation, okay, and a drinking water facility and a sitting facility with social distancing, and obviously the immediate medical facilities in case of any immediate problem like anaphylaxis or any other medical emergencies. So waiting room, vaccination room, and observation rooms, a minimum of 3 rooms, that is. We'll not be talking about this in detail, but there will be four officers. One is the verification. The first one's responsibility is identity verification, and then the next one's responsibility is verification in the app, that is COVID app, and then vaccinator, and then we have the the person who can observe the patient in the post vaccination period, that is for a minimum of 30 minutes, and then we have another person who can take who manage the 3 rooms, that is about management. So what are the 4 important vaccination messages? The first thing is that we have to tell the patient that once he has taken the vaccine, it is going to protect him from the COVID-19 virus, but it is not absolute. That we have to make them understand that it is not 100% effective. As for the Covishield, the reported effectiveness is about 70.8, and as for the Covaxin, it is about 81%. Okay. So and obviously even after taking the vaccine, we have to advise the patient to not to stop using precautions like using a mask or washing hands with soap and water or maintaining physical distancing. So in case of any discomfort after taking the vaccine, he is to be advised to contact any nearby healthcare worker, be it the ASHA worker or any of the healthcare staff in the nearest primary health center or community health center or any civil hospital. And obviously, he's going to be told that he will get information on his mobile phone about his next dose, that is the second dose. So we all know the precautions that are to be taken. So masks is to be worn, okay, and we are not supposed to remove mask while talking. We are supposed to keep our hands clasped, not to touch our face, maintain social distancing, ensuring proper ventilation by keeping the doors and windows open, and yeah, obviously, even while eating, we are supposed to maintain some physical distancing. Okay, now coming to the some frequently asked questions. Okay. Yeah, the frequent asked questions are not limited to this, but I have tried to answer some other questions that people are likely to ask. So the first question is, can the vaccine be given to everyone at a single time? Ideally, yes, we can, but the thing is, India is a very huge uh, is a country with a huge population. So the government has strategized in such a way that the first phase that was started on 16th of January was meant for the frontline workers. That was the number was about 3 crores. The second phase that is started on 1st of March, it was aimed at all the citizens above the age of 50 and people age 45 with uh, comorbidities. The third phase is going to be for everyone. So this is likely to be started somewhere in April. And the next question is, will the vaccine be safe? Because people feel that it has been tested and introduced in a very short span of time without proper, what to say, clinical trials. However, we have to understand that we have strict regulatory bodies, okay, and these vaccines have been passed by these regulatory bodies after careful study. And obviously, we have to understand one thing: extreme measures, extreme situations demand extreme measures. So the thing is that COVID was fast spreading. In fact, the COVID pandemic was fast spreading, and we cannot for years that the clinical trials that normally take for the vaccines to be approved, because we need to take some drastic measures. But our regulatory bodies still ensured that there was no compromise when it comes to the safety. Yeah, obviously there was uh, some kind of a hastening of the decision taking, but as far as the safety concerns, as far as safety concerns are concerned, like the regulatory bodies are of the opinion that there was no compromise, and obviously, Covaxin, the report on Covaxin that has come out uh, a few days ago, they have proven that there has been no significant compromise with the safety concerns. Then the next question is it mandatory to take the vaccine? Yeah, as of now, the vaccination for COVID-19 is voluntary, and it is advisable for protecting oneself against this disease and also obviously to limit the spread of the disease to to our close contacts. And then the next question is, out of the multiple vaccines available, how is one or more vaccines chosen for administration? As of now, we don't have much option. We have only two options. Another vaccine is likely to become an option for us. That's Sputnik one, but that is that is sometime down the line. So the safety and efficacy data from clinical trials of the candidate vaccines actually that we have told were examined, and they have cleared Covaxin and Covishield as of now. And the next question is, how many doses of vaccine would have to be taken by the patient and at what interval? Because the recommended number of doses is two. That is two doses of vaccine, 28 days apart as of now. But yes, we have to keep in mind that there may be some changes later on, because the thing is there are certain studies that say that uh, if it is given about 12 weeks apart, that is 3 months apart, and if efficacy may be better. So talking about the time of antibodies developing, that is when does the vaccine start protecting the person? So the answer is 2 weeks after receiving the second dose of the COVID-19 vaccine. That means that the patient can still get infection before this time period of 2 weeks after the last dose of uh, the vaccine. And obviously the two, like the oft repeated questions, like will the vaccine introduced in India be as effective as the ones introduced in other countries? Yes. Covaxin is an Indian-made vaccine that is produced by Bharat Biotech, and it is in fact its efficacy is 81%, and that is in fact better than 70.8% that has been reported with Covishield. Covishield actually it's an Oxford and AstraZeneca this one collaboration, and that is produced by Serum Institute of India. But however, Covaxin has proven to be more efficacious than Covishield. So while we educate a patient, we have to tell them which documents are valid for identity verification. So we have all this all this identity, what to say, verifying documents, Aadhaar card, driving license, okay, health insurance, and MZ Narega job card, PAN card, and all this, and passport, and all these things. So then the one may ask that can we get the COVID vaccine without registration at the health department? The thing is that the answer is no, because registration is mandatory. And if the person is suppose not able to produce photo ID at the session, will he or she be vaccinated or not? No, because identity verification is a must. Okay. Yes, as we have just talked about, the person will get the uh, SMS on the registered phone number, registered mobile number regarding the due date and the time. Then the very important question. For example, someone had COVID and he has recovered. The question is it necessary for him to get the vaccine? The answer is yes. It is advisable to receive the complete dose of the vaccine, irrespective of the past history. And also the CDC, that is the Center for Disease Control in America, also suggests that individuals who receive monoclonal or convalescent plasma, we know that tocilizumab and that convalescent plasma therapy, if the person received those therapies, then COVID-19 should preferably be delayed for at least 90 days from the time of receipt. Then the next question is, can a person presently having COVID-19, either confirmed or suspected, okay, be vaccinated? So the thing is that a person with confirmed or suspected COVID-19 infection may increase the risk of spreading the infection to others at the vaccination site. So they are advised to defer vaccination for at least 14 days after symptom resolution. That is the time when the person stops being infected. And are there any preventive measures and precautions after that? Well, first thing is that the person is going to be asked to be under observation at the center for about 30 minutes, and when there is no adverse event during the time period, he is sent home, but with the advice that he should contact the nearest health authorities in case of any problems. And he is supposed to continue following the COVID appropriate behaviors. Yes, for many of us, the all important question happens to be, should we avoid alcohol after receiving COVID-19 vaccine? It is equally important because many people who are used to having alcohol, they may even avoid taking the vaccine, because the thing is that there is some misconception regarding the consumption of alcohol and the vaccine efficacy. However, our health regulatory bodies have clearly confirmed that there is no evidence of alcohol impairing the effectiveness of the vaccine. So, people who are used to taking moderate amounts of alcohol, they should be advised to take the vaccine. And then, if one is taking medication for illnesses like cancer, diabetes, hypertension, etc., like is he or she eligible to get the vaccine? Yes, he is eligible and he should get. Because the thing is, these persons are very at a very high risk to get a severe disease in case they get a disease. And then this very important precaution in patients with bleeding or coagulation disorders. Some people with bleeding disorders like hemophilia, actually, they are advised to get the vaccine under supervision of their treating physician. Number two, patients who are admitted in the hospital or ICU and have bleeding complications, they are advised to delay the vaccination till they are discharged. Why? The reason is these vaccines are given intramuscular. So when their blood, when their blood is, when they are prone to develop bleeding complications like hematoma, so we should rather avoid giving the vaccines during that time. Once their coagulopathy is controlled, then the patients, these people can get a vaccine. However, one caveat is that people with heart and brain disorders and who are on blood thinners like aspirin and antiplatelet drugs, they can continue with the medicines and have the vaccines. So what about allergy? For example, if I have allergic rhinitis or bronchial asthma, am I ineligible to get a vaccine? I'm in fact very much eligible to get a vaccine because the only contraindications that have been listed by the health ministry include the persons with a history of immediate or delayed onset anaphylaxis or allergic reaction to pharmacological products, that is any medications, food items, or injectable items, or if the person had any kind of allergic reaction to any kind of vaccine that he had taken ever in his life. So these are the only contraindications. So if the person has allergic rhinitis or bronchial asthma, that doesn't mean that he is ineligible to get a vaccine. Then the next question is, are pregnant women and lactating mothers to be given the vaccine? Yeah, here there is some ambivalence. Initially, it was said that the vaccine has not been tested in this group of people among the pregnant women and the lactating mothers, and that should not be given. But there are opinions, and even the WHO has said that we can give this under special circumstances, especially when they are at a very uh, high risk and when they have immunocompromised people at home, because they can give the infection to the immunocompromised people. So, as a social mobilizer, what is my role in the vaccination process? My first role is spreading awareness about the vaccine, Secondly, we can help out during the vaccination process and after the vaccination if any kind of adverse effects or discomforts are reported, then we can help in taking care of those. Yes, in the pre-vaccination stage, we have we can spread awareness about the benefits of the vaccine and its role in controlling the pandemic. We can educate the patients, people about the registration process. We can increase awareness. We can remind people to carry ID proofs to the vaccination centers. Yes, obviously we can help in crowd management at the centers. We can take help from influencing people in spreading awareness. Yes, we can ask them to avoid taking vaccine if someone is infected, and we we can increase the people. We can encourage the people to take the vaccine. We are all too aware of the information, communication, and education documents, and during the vaccination stage, like we are supposed to check if the beneficiary is taking all the precautions at the vaccination site, crowd management again, then making entry and the process and smoothing the process, and checking if the beneficiary, that is person who has just taken the vaccine, takes trace for 30 minutes after the vaccination, and we should educate them to come back in case of any adverse events even after that. After that, we are supposed to ensure that coordination for the vaccination is important, and we have to remind the beneficiary about the second dose. And whenever there are any confusions or misinformation in the society, we are supposed to help dispel them, and we have to advise them for a quick follow-up if they feel unwell or have any side effects to the vaccination. And we can support the healthcare staff in case of any adverse events. So let's not forget about these five precautions. And with this, I end my talk. And I would be happy to take questions, be it in English, Hindi, or Manipuri.
Thank you so much, sir, for effectively giving the information. And now I would request if anyone has any questions, they can either raise their hand, we will unmute them and they can ask their question, or they can ask in the chat box also if that is fine.
Yeah, some questions are there in the chat box.
Yes, sir, we have one question.
Yeah,
I think the question is the vaccine to be taken annually or it is for the lifetime?
yeah. As of now, the effective duration of the the vaccine's efficacy is about 6 months. Actually, we don't have enough data because the vaccines are all new. So, as of now, the efficacy is about 6 months. Like the efficacy lasts for about 6 months. Whether we are supposed to repeat it yearly or not will be answered by further studies.
I hope, Mr. Shanta, your doubt has been cleared. If anyone else has any question, kindly raise your hand or they can type in the chat box also. Otherwise, we can close the session. We'll wait for 2-3 more minutes if anyone has any question.
Sivagiri, can I in?
Sure, Shanta, sure.
if the participants are not having any other questions before we end, I would like to apologize for not able to make an introduction of our resource person, Dr. Pahil and Soibam, before we start the uh, program. I mean the session due to some connection problem from my side. So I would like to take that opportunity to introduce her to everyone. Many of the participants might know about sir, but so for some of us we don't know. I mean, may not be knowing. So Dr. Pahel M. Soivan is an MD internal medicine and also DM from pulmonary and critical care medicine. He possesses 2 degrees, and also he is now working as an assistant professor of medicine in Jennings, Imphal East, Manipur. And also he is very much super specialist in some of the very important area. uh, those are chest disease, interventional pulmonary, critical and intensive care medicine, and sleep medicine. And sleep medicine for me is very new, and I will try to get more regarding this from sir. And also he is specialist in medicine also. So he is a compact, combo, with lots of area for us, and he is very resourceful for us. And I would like to thank sir also for giving us this time, because we had been already uh, given some of the resource person from health department and from Dr. Prem Chandra. I would like to thank him also for recommending many resourceful doctors from the health department. And sir is personally recommended by Dr. Uthan, who is also senior resident in Jennings. And I would like to thank Dr. Uthan also, even though he is not present here. And I would like to thank SDMA Manipur, especially Sir Ranjit Akoizam, who has been helping us from the very beginning to bring out this academy successful. And I would like to thank all the participants who are all patiently joining us and trying to get all the information. And I really appreciate it, and I hope that they will be the person who will be social mobilizer and carried out all this important information to the other people who are in need of this information. Thank you one and
Shantoi,
all.
can I come in?
Yes, Sivagini,
Yeah,
please.
Dr. Pahel, we have one more question from Mr. Shanta.
Okay.
Mom is 60 plus age and she is a patient of arthritis as well. So, can she take the vaccine? Will it be will there any be side effects, or like, is it okay for her to take the vaccine?
Yes, obviously.
Okay.
Patient can take the vaccine. There is no, actually, the thing is, the side effects are very minimal, actually. The most of the side effects that has been reported so far are very mild. Either because either pain at the injection site or some fever or headache. Actually, these side effects can be there with any other vaccine as well. So we don't have to be very fearful about these vaccines.
Okay, thank you so much, sir. I think, Mr. Shanta, the doubt has been cleared. Over to you, Shantoi. Thank you.
Yeah, thank you very much, Sivangini. Even from my side, it's almost done. And I think if anything missed out, and from the participants side, anything you want to raise questions regarding vaccination or anything you'd like to know about the session or anything, you are most welcome.
Shantu, you can make the certificate announcement as well.
Yeah, and for the certificate, we will be sending through the email, so we will not be able to provide you in hard copy. So you can, will be in a very, we'll give you an information that when we are dispersing the certificate, so you can get it from, through the, by downloading from your email. So we'll be sending through your emails. I think we don't have much
Yes,
questions from the
and
participants
you
also.
can you can download also your certificate from the COVID-19 Academy website, our website, which is www.covid19academy.org. So I think post 48 hours of the session, we will be uploading the certificates there as well. You can download it from there as well. And as Shantanu has mentioned, she can send it over email also. We have one more question, sir.
Yeah.
Uh, Okay. Her mom, I think Prem Singh has asked the question. His mom is a diabetic patient. Can she also take the vaccine?
Yes, yes, very much. As I told, actually the contraindications are very few. In fact, if your mom is a diabetic, she is that is all the more the reason why she should take the vaccine.
Okay, so we have one more question from Mr. Shankar. Can the vaccine be taken with influenza and I think it's pneumonial vaccine, pneumococcal?
Yeah, basically, there should be the recommendation is that there should be a minimum of 2 weeks gap between the COVID-19 vaccine and this influenza and the pneumococcal vaccines. That is a recommendation.
Uh, I think we have okay. I think Shantanu, you can close the meeting. We don't have any more questions.
Okay. So once again, thank you very much, sir. And I apologize if, I mean, is there any kind of inconveniences from our side? And thank you very much for giving us, I mean, sparing your valuable time. And I know now, I mean, the all the doctors and all the health workers are so much busy with the, I mean, health works. Still, I mean, he managed to spare us some time and give us this valuable information, sir. So, sir, thank you very much from my side and from the whole team of Spare India. And everyone, each and everyone, whoever has joined us. And I would like to take the permission to close the session for today. Okay, everyone, bye and have a nice day.
Thank you, everyone, for joining in. Dr. Pahal, are you still there? I think we have one raised hand.
Yeah, yeah, yeah. I'm still.
Yeah. Mr. Ramesh, I think you have raised hand. Do you have any question?
Hello.
Yes. I think so. We can close the meeting, sir. Okay. Thank you so much, sir. Thank you so much, Dr. Pahal, for joining in.
Okay, okay. Thank you.